Morphine can make you itchy, not because you're allergic, but because it actually activates the mast cells. This is a non IgE mediated histamine release that can look like anaphylaxis with hypotension, tachycardia, and even wheezing, but it's not allergies. That's why drugs like fentanyl, which don't dump histamine, are preferred in sensitive patients. And so here, when we're looking at non-IgE mast cell degranulation, we think of morphine because it has direct mast stimulation, causes pruritus, bronchospasms, hypotension, tachycardia. No rash is needed, no prior sensitization is required. So that's why we use fentanyl and hydromorphines. Okay, so 58-year-old man recovering from abdominal surgery. After he receives his morphine for pain, he has a flushing, chest tightness, and pruritus with rash. The labs are showing low blood pressure and high heart rate. What's the mechanism? So it's going to be your non-IgE mast cell degranulation. Low potency opioids are going to trigger this mast cell release. Not IgE mediated hypersensitivity, that's a type 1 reaction that requires prior sensitization, and it often presents with urticaria, hives, angioedema. It's rare with your opioids. And cyclooxygenase activity, it's not going to be that your NSAID sensitivity. It would cause your bronchospasms, but no hypotension, no itching. Myocardial depression, allophane, and that would explain the hypotension but not the wheezing. Some other answers that you might see would be like your decreased myocardial contractility. So, for instance, halothane can cause hypotension and myocardial contractility suppression, not your itchiness. Decreased sympathetic output. Opioids will actually reduce your sympathetic output and they can decrease heart rate and blood pressure. However, opioids alone, this would not explain your itching and your wheezing. The decreased sympathetic output alone would not be responsible for this patient's condition. And so it has to be something allergy related if they're asking, hey, why is this person seizing up? And the answer is going to be not decreased sympathetic output, but direct mast cell degranulation. So your morphine, your opioids can cause your pseudo-allergic response that stimulates your mast cell degranulation. So that's the key here. Generalized itching, hypotension, tachycardia. This can all be seen without prior sensitization. So true IgE-mediated allergic reaction is rare with your opioids, but the morphine can definitely cause a pseudo-allergic response by activating those mast cells and causing that degranulation. So we'll see you in the next video. Take care. Ciao.